In May 2022, I'd turned 46 years old, and I felt perfectly fine. And I was looking forward to another summer. We went on this camping trip, and a few days into it, I woke up in our tent, and I literally couldn't move. I'm in my sleeping bag. I can barely sit up. I could barely walk. My face is swollen.
Yeah,
something was very wrong. And so, they took an x-ray, and they kind of pulled me aside. They said, "I'm pretty sure this is lymphoma. Do you know what lymphoma is?"
I was just kind of in shock. Oh my goodness, I was not expecting to hear that. And then it was, all right, what do we have to do next?
Battery of tests, further imaging and scans, and eventually they got their way down to the subtype large B-cell lymphoma. The treatment was described as essentially 5 days, 24 hours a day of chemotherapy, followed by roughly 2 weeks off, and that sequence would repeat 6 times.
Initially, Rob was so sick to begin with, it almost was a joke that Friday night was date night at the ER. So we spent a lot of time in the emergency room with various issues.
I was hoping that I would fall into this lucky percentile where this works for me, that I've reached remission, but the imaging showed otherwise, and learned that I was not looking at a very good prognosis at that point. So we sought out the advice of the National Institute of Health, and they helped devise a plan that included CAR T. We were certainly interested in CAR T from our understanding of its effectiveness, and having an outpatient experience was a primary factor in our decision.
Indications. Breyanzi is a prescription medicine used to treat a type of non-Hodgkin lymphoma, large B-cell lymphoma, when your first treatment has not worked, or your cancer returned within a year of your first treatment, or your first treatment has not worked, or your cancer returned after the first treatment, and you are not eligible for hematopoietic stem cell transplantation because of medical conditions or age, or 2 or more kinds of treatment have not worked or stopped working. Breyanzi is different than other cancer medicines because it is made from your own white blood cells, which have been genetically modified to recognize and attack your lymphoma cells. Important safety information. What is the most important information I should know about Breyanzi? Breyanzi may cause side effects that are life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: difficulty breathing, fever 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, severe nausea, vomiting, diarrhea, fast or irregular heartbeat, dizziness, lightheadedness, severe fatigue or weakness. These are not all the possible side effects of Breyanzi. Call your doctor for medical advice about side effects. For more information, go to breyanzi.com or call 1-888-805-4555. You may report side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warnings and medication guide.
The infusion itself was actually fairly uneventful and went by pretty quick. Overall, my experience was fairly mild. By day 30, the doctors, the oncologists, were pretty thrilled. It was a complete response, 0 trace of lymphoma,
of disease.
No evidence of disease. Yeah, that's a great phrase. When you're a young person, you feel you will live forever, that you won't be in the car accident, you won't get cancer, and then one day it happens to you. And yeah, that changes you. And it can make you afterwards stronger and more resilient, and you value the things that were almost taken away. You know, I realize those things are more precious now. And I couldn't ask for a better partner. Obviously, this part is very raw for me.
If you have the opportunity to do CAR T, do it. Do it. Run towards it as fast as you can.
Important safety information. What is the most important information I should know about Breyanzi? Breyanzi may cause side effects that are life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: difficulty breathing, fever 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, severe nausea, vomiting, diarrhea, fast or irregular heartbeat, dizziness, lightheadedness, severe fatigue or weakness. It is important that you tell your healthcare providers that you have received Breyanzi and to show them your Breyanzi patient wallet card. Your healthcare provider may give you other medicines to treat your side effects. Before getting Breyanzi, tell your healthcare provider about all your medical problems, including if you have or have had neurologic problems such as seizures, stroke, or memory loss, lung or breathing problems, heart problems, liver problems, kidney problems, a recent or active infection. Tell your healthcare provider about all the medications you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How will I receive Breyanzi? Breyanzi is made from your own white blood cells, so your blood will be collected by a process called leukapheresis. It takes about 3 to 4 weeks from the time your cells are received at the manufacturing site and are available to be shipped back to your healthcare provider, but the time may vary. Before you get Breyanzi, you will get 3 days of chemotherapy to prepare your body. When your Breyanzi is ready, your healthcare provider will give it to you through a catheter placed into your vein, intravenous infusion. Breyanzi is given as infusions of 2 different cell types. You will receive infusions of one cell type, immediately followed by the other cell type. The time for infusion will vary, but will usually be less than 15 minutes for each of the 2 cell types. During the first week, you will be monitored daily. You should plan to stay close to a healthcare facility for at least 2 weeks after getting Breyanzi. Your healthcare provider will check to see that your treatment is working and help you with any side effects that may occur. You may be hospitalized for side effects. Your healthcare provider will discharge you if your side effects are under control and it is safe for you to leave the hospital. Your healthcare provider will want to do blood tests to follow your progress. It is important that you do have your blood tested. If you miss an appointment, call your healthcare provider as soon as possible to reschedule. What should I avoid after receiving Breyanzi? Avoid driving for at least 2 weeks after you get Breyanzi. Do not donate blood, organs, tissues, or cells for transplantation. What are the possible or reasonably likely side effects of Breyanzi? The most common side effects of Breyanzi are fatigue, difficulty breathing, fever 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, difficulty speaking or slurred speech, severe nausea, vomiting, diarrhea, headache, dizziness, lightheadedness, fast or irregular heartbeat, swelling, low blood pressure, muscle pain. Breyanzi can increase the risk of life-threatening infections that may lead to death. Tell your healthcare provider right away if you develop fever, chills, or any signs or symptoms of an infection. Breyanzi can lower one or more types of your blood cells, red blood cells, white blood cells, or platelets. After treatment, your healthcare provider will test your blood to check for this. Tell your healthcare provider right away if you get a fever, are feeling tired, or have bruising or bleeding. Breyanzi may increase your risk of getting cancers, including certain types of blood cancers. Your healthcare provider should monitor you for this. Having Breyanzi in your blood may cause a false positive HIV test result by some commercial tests. These are not all the possible side effects of Breyanzi. Call your doctor for medical advice about side effects. For more information, go to breyanzi.com or call 1-888-805-4555. You may report side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warnings and medication guide.